For 30 years, I believed I understood heart disease better than most people alive, and I was wrong. Not completely wrong, but wrong in the one way that matters most. Because the truth is, the thing we tell patients every single day, the thing we build entire treatment plans around, does not fully address what is actually happening inside their arteries. I know that sounds uncomfortable, maybe even hard to accept, but stay with me for a moment, because what I'm about to share is not theory, not speculation, but something I was forced to confront personally. A few months ago, I sat down and looked at an ultrasound of my own arteries, not a patient's, mine, and what I saw was something I had spent decades warning others about. Plaque, quietly forming inside the vessels that are supposed to keep me alive. Not severe, not critical, but undeniably there. And in that moment, everything shifted. Because if someone with my level of knowledge, my level of awareness, could still develop this condition without feeling a single symptom, then the question is no longer whether this is happening, it's how many people are living with the same silent process right now without realizing it. And more importantly, whether what we are currently doing is truly enough to stop it. I've spent most of my life inside operating rooms, standing over open chests, holding beating hearts in my hands, making decisions that determine whether someone goes home to their family or doesn't. I've performed thousands of procedures, seen every stage of cardiovascular disease, from early buildup to complete blockage, and I built my confidence on the belief that I understood this process deeply enough to guide others through it. Patients trusted me because I spoke with certainty, and I believed that certainty was earned. But sitting there alone with my own scan, that certainty felt different. It wasn't fear that hit me first, it was recognition. I knew exactly what I was looking at, exactly how it had formed, exactly where it could lead if left unchecked. And for the first time, I wasn't the surgeon explaining options across a desk. I was the person on the other side of that conversation. I realized something uncomfortable but necessary. Knowledge does not make you immune. Experience does not protect you from biology. And if I had followed the same routine I had recommended countless times before, monitor it, manage the numbers, check again later, I would be doing exactly what I had always done, without ever questioning whether that was truly enough. That moment forced me to stop thinking like a physician for a second and start thinking like a human being who wanted a real answer, not just a standard one. And that is when the realization becomes impossible to ignore. This is not just about me, and it is not just about a handful of patients sitting in a cardiology office. This is happening to millions of people, quietly, predictably, and often without a single warning sign strong enough to demand attention. If you are in your 50s or 60s, there is a very real chance that this process has already been unfolding inside your arteries for years. Not suddenly, not dramatically, but slowly, layer by layer, long before any diagnosis was ever made. The problem is that it doesn't announce itself. It doesn't cause pain early on. It doesn't interrupt your daily life until it has progressed far enough to become dangerous. So people assume they are fine because they feel fine, while something very real continues to build beneath the surface. This is what makes it so difficult and so dangerous, because by the time most people discover it, they are not at the beginning of the process. They are already somewhere in the middle of it, trying to catch up to something that has been developing in silence for decades. To understand why this matters, you have to look beyond the simplified version most people are given and see what is actually forming inside the artery wall. Imagine the inside of your artery like the smooth lining of a garden hose, designed to let blood flow effortlessly. Over time, that lining gets damaged, sometimes from high blood pressure, sometimes from smoking, sometimes from chronic inflammation that builds quietly over years. When that damage happens, your body does what it is designed to do. It tries to repair it. But the repair process is not clean or perfect. LDL cholesterol moves into the damaged area. Immune cells arrive to deal with what the body interprets as a threat. And a protein called fibrin begins to form a kind of structural framework, like scaffolding at a construction site. This is the part most people never hear about. Because once fibrin is laid down, it doesn't just sit there temporarily. It creates a stable structure where cholesterol, calcium, and cellular debris begin to accumulate and harden over time. What you end up with is not a soft layer that can simply be washed away, but a dense, organized mass that becomes part of the artery wall itself. It's closer to a scar or a hardened buildup than anything resembling fat floating in a pipe. And the longer it sits there, the more complex and resistant it becomes. Which is exactly why understanding this structure changes how you think about what it actually takes to affect it. This is where one of the most common misunderstandings begins. And it is a misunderstanding that shapes how millions of people think about their own health. Lowering cholesterol is important, and medications like statins can absolutely reduce risk in the right context. But reducing a number on a lab report is not the same thing as removing what has already formed inside the artery wall. Those are two very different outcomes, and they are often treated as if they are the same. When you lower LDL, you are reducing the supply of material that contributes to future buildup, but you are not directly dismantling the structure that already exists. The plaque does not simply disappear because the input has been reduced. In many cases, it stabilizes. It may grow more slowly, but it remains there. And that distinction matters. Because if the goal is not just to manage risk, but to truly change what is happening inside the body, then focusing on one piece of the process while ignoring the rest leaves a significant part of the problem untouched. So the question becomes unavoidable. And once you see it clearly, it is difficult to ignore. If plaque is not just cholesterol, but a structured mass held together by multiple biological processes, then what actually has the ability to change it in a meaningful way? What slows it is one thing, but what can influence it from the inside out? And if oxidation is what starts the damage, inflammation is what keeps it active, and a protein framework is what locks it into place, then why are we only targeting one part of that system? Because once you begin to ask that question honestly, it opens the door to a very different way of thinking about the problem. The first shift in thinking came from looking at the very beginning of the process, not the end of it. If oxidation is what triggers the initial damage to the artery wall, then reducing that oxidative stress changes the environment where plaque begins. This is where something surprisingly simple enters the conversation: pomegranate. Not as a trend, not as a vague, healthy food, but as a compound-rich source of antioxidants that directly interact with LDL particles before they become harmful. When LDL is not oxidized, it is far less likely to initiate the inflammatory cascade that leads to plaque formation. At the same time, pomegranate has been shown to improve the function of HDL, the mechanism your body uses to remove cholesterol from arterial walls and transport it back to the liver. So instead of only focusing on reducing what comes in, you are also improving what goes out. It is not a dramatic intervention, and that is exactly why it is often overlooked. But when you change the internal environment consistently over time, you begin to influence the process at its earliest stage, before it has a chance to accelerate. But addressing the beginning of the process is only part of the picture, because once plaque has already formed, you are no longer dealing with just chemical signals, you are dealing with structure. And this is where the second mechanism becomes critical. If fibrin is the protein that acts like the cement holding that structure together, then breaking it down changes the integrity of the plaque itself. This is where an enzyme called nattokinase comes into focus. Derived from a traditional fermented food, its primary biological role is to break down fibrin networks in the body. That is not a side effect, it is its function. Instead of influencing cholesterol levels, it interacts directly with the framework that makes plaque stable and resistant. When that framework begins to weaken, the contents of the plaque are no longer as tightly bound, which may allow the body's natural processes to gradually clear what was previously locked in place. This is not about replacing one approach with another, but about adding a missing piece addressing not just how plaque forms, but what physically keeps it there. What makes this approach worth paying attention to is not the theory alone, but the evidence that has begun to support it over time. In clinical observations and smaller controlled studies, individuals who consistently consumed pomegranate in concentrated form showed measurable changes in arterial wall thickness, not just stabilization but actual reduction over extended periods. At the same time, laboratory data has repeatedly demonstrated its ability to significantly reduce LDL oxidation and improve HDL function, both of which directly influence how plaque develops and how the body manages it. On the other side, studies examining nattokinase have reported notable reductions in markers associated with arterial stiffness and plaque burden when used consistently at appropriate doses. These are not isolated anecdotes, but patterns that have appeared across multiple investigations. While they may not carry the scale of large pharmaceutical trials, The consistency of the findings points to something biologically meaningful, something that aligns with how these mechanisms are understood to work inside the body. At this point, a reasonable question naturally comes up: if this information exists and the mechanisms make sense, why is it not part of every standard medical conversation? The answer is not that anyone is deliberately withholding it, but rather how the system itself is structured. Modern medical guidelines are built on large-scale clinical trials that require enormous funding, and that funding typically comes from organizations that can develop and patent specific treatments. Naturally occurring compounds, no matter how promising, do not fit easily into that model because they cannot be owned in the same way. As a result, the research that does exist is often smaller, less publicized, and slower to influence official recommendations. At the same time, physicians are working within limited time, expected to prioritize established protocols that are widely accepted and clearly defined. It is not a matter of neglect, but of practicality within a system that does not always make room for every emerging angle, even when it deserves attention. Once you understand the mechanisms, the next step is not to rush into action, but to apply it in a way that is consistent, measurable, and responsible. For something like pomegranate, the approach is straightforward: small, regular intake over time, not large amounts all at once. Consistency matters far more than intensity, because the goal is to gradually influence oxidation and support the body's natural cholesterol transport system. With nattokinase, the approach requires more attention. It is typically taken on an empty stomach to support absorption, and it should never be added blindly if you are already using blood-thinning medications or have a history of bleeding issues. This is not optional caution, it is essential. At the same time, one of the most practical steps you can take is to establish a baseline. Imaging your arteries, tracking measurable markers, and reassessing over time gives you something real to work with. Without that, you are guessing. With it, you are making informed decisions based on how your body is actually responding, not just what you hope is happening. After I understood all of this, I made a decision that felt both professional and deeply personal. I would not recommend anything I had not been willing to test on myself first. I followed a consistent routine, kept everything measured, and most importantly, I gave it time. A few months later, I went back for follow-up imaging, not expecting anything dramatic, just hoping to see stability. What I saw instead was a shift in the right direction. Not perfect, not a complete reversal, but enough to confirm that something real was happening. And that moment mattered not because it proved a point, but because it reminded me that the body is not fixed. It responds, it adapts, and when you begin to address the problem more completely, even small changes can become meaningful over time. The most important realization is this: heart disease is not just a number on a lab report, and it is not a single problem with a single solution. It is a process built from multiple layers: oxidation, inflammation, and structure. And if you only address one of those, you are not truly changing the outcome. Slowing something down is not the same as turning it around. And understanding that difference is where real progress begins. If you step back and look at the full picture, the logic becomes clear. Plaque does not form from one cause, and it does not respond to one solution. It begins with oxidation, is sustained by inflammation, and is held in place by a physical structure that does not simply disappear. Addressing only cholesterol may slow the process, but influencing multiple pathways is what creates the potential for real change. If this made you think differently about your own heart health, do not let the conversation end here. Ask better questions, look deeper than surface-level numbers, and take the time to understand what may already be happening silently inside your body. And if this perspective resonates with you, share your thoughts below. I want to know what your doctor has told you and what they may have left unsaid. Everything you have heard here is meant to inform, not replace the medical care you already receive. Your health is not a theory, and it should never be managed based on a single source of information, no matter how convincing it may sound. Every individual is different, and factors like your medical history, current medications, and overall risk profile must be considered before making any changes. If you are taking blood-thinning medications, managing chronic conditions, or have a history of cardiovascular events, it is essential that you speak with your physician before introducing anything new. This is not about rejecting conventional treatment, but about understanding it more completely and, where appropriate, expanding the conversation. The goal is not to act impulsively, but to act with clarity, responsibility, and a full awareness of how your decisions may affect your body over time.